Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So Dr. Kim, when you're analyzing the nose, the patient comes in during the consultation. How do you analyze it? What questions do you ask the patient?
There are a lot of questions because, as you know, it's a very holistic approach. First thing is literally your medical or surgical history. In other words, we need to know, have you had trauma? Do you have a history of allergies? Do you have sinus issues? And more. Because rhinoplasty, as you mentioned, is functional as well as cosmetic. Then, of course, just like our mentor, Dr. Rorik says, there are usually three major things that I think patients want with their nose. We as plastic surgeons may notice 2 things or 10 things or whatever, but patients typically have 3 major things, and we have to address those 3 major things. Finally, patients may not fully realize that, but we know this. There are issues with the bone. There's issues with the cartilage. There's issues with the upper, middle, and lower portions of the nose. There are issues with what you want the tip to look like, as well as multiple angles. How do you want your nose to look at, like from the front, from an angle, from the side? And we have to take all of that into consideration. So it's pretty complicated because there are a lot of questions and a lot of anatomic structures we need to think about to give the best results. So how do you approach it?
I completely agree. I think we want to know everything about the nose, anything that might have happened. Trauma, like you said, is really important. Anything that would impact breathing. So I asked similar questions from that component. I think asking the top 3. So there's so many elements. I mean, it's like a 20-step like physical exam analysis of the nose for us to look at it. But, we may see things that the patients like never noticed and doesn't really bother them. So really getting in the mind of the patient and asking them what their major concerns are is important. And then I also like, and I like this more for the profile than for the center, but I like to do a little bit of photo editing too, because most people want, if there's a bump, most people want that gone. But then there's like degrees of rotation of the tip. And I call it like some patients they want like a little bit more of a modern, straighter nose. Then there's like a little bit of a ski slope, and then there's full on Disney princess. I think most of my patients probably want something in the middle, but it's helpful to do a little bit of Photoshop or similar software so that they can see that on their own face. And that gives me a sense of putting into, an image these descriptions that they're giving us. And then we'll also talk about nostril position too, especially if we're making a nose smaller or setting it back. That can lead to some rounding of the nostrils. We want to make sure that we address those at the end of the operation too.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.